Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullah. We are going to discuss a group of anemias which are hypochromic microcytic anemias. They are classified into iron deficiency anemia, sideroblastic anemia, thalassemia, and anemia of chronic diseases. All these are examples for microcytic hypochromic picture. Clinical manifestations of anemias in general are so many. These clinical features may occur in different types of anemia, like megaloblastic anemia, iron deficiency anemia, hemolytic anemias. But every one of these anemias has specific clinical features plus these classic features. So classical signs of anemia, we have number one, pallor, fatigability and headache, dyspnea, palpitations and tachycardia. If the condition is severe enough, it can lead to heart failure, and intermittent claudication, which is pain in the legs, comes and goes, so intermittent, on and off pain. So all these are classically occurring in different types of anemias. This picture shows pallor. It can be seen in conjunctiva of the eyes, asking the patient to look upward and pulling the eyelids down to see the conjunctiva, or in the palms of the hands. Also, it can be obvious. Iron deficiency anemia is a widespread disease, and there is no regulated pathway for iron excretion. Absorption is the only way to regulate iron status in our bodies. No classical way to excrete iron through renal tract. So this may lead to problems in patients subjected to iron overload, because renal system cannot excrete this iron, and this occurs classically in patients on regular blood transfusions, like patients having chronic hemolytic anemias, for example thalassemia. These patients are dependent on transfusions, so with time there is more iron in their bodies, and the body cannot routinely excrete this iron in the urine. So if you don't give them therapy to get rid of iron, they may end up with iron overload. Chronic blood loss is the most important cause of iron deficiency anemia in the Western world, but in our countries still dietary problems can play important part in iron deficiency anemia. Regardless of the cause, iron deficiency develops insidiously. Iron stores are depleted first, then anemia follows. So the patient will have a state of iron deficiency before he gets anemia with time. Sources of dietary iron, we have meat, vegetables, eggs. Vitamin C is very important for absorption of iron. Transferrin is the protein for transport of iron. Ferritin and hemosiderin are storage forms, as you know from your previous studies. And hemosiderin can be seen in macrophages and inside other cells, and it can be checked for by a reaction or a test called Russian blue reaction. Absorption of iron occurs in the duodenum, and there are certain factors which affects this absorption, like ferric form will delay absorption. Ferrous is more suitable. Alkalis and antacids plays also a role in delaying the absorption. Infections and drink of tea. It occurs, iron deficiency anemia occurs due to low iron, and the RBCs are, as we mentioned, small microcytic and with low hemoglobin اللي هي hypochromic cells. CBC characteristics, we have of course anemia, and we have microcytic hypochromic cells in the peripheral film. The anemia is checked by low hemoglobin, low PCV,